Hi everybody, I'm Nick Talley. I'm a doctor, I'm a researcher, I'm a laureate professor at the University of Newcastle, and I'm editor-in-chief of the Medical Journal of Australia. And I've been asked today to talk about COVID and whether we're doing enough. So I'm going to make 3 points. Firstly, we've got to socially distance. I certainly support the government restrictions now in place, including on travel, etc., but we can do even more. This is the bare minimum. The more we can do to socially distance, the more we can suppress this infection. The infection's in the community and we have to fight it in the community, and this will make a big difference. The hospital system we have is excellent, but there's more we need to do to ensure we're going to deal with the coming surge. I know we'll do a really good job, but it's terribly important frontline clinicians lead here, that there's a proper command and control structure, that bureaucracy gets out of the way so that clinicians can really do their job well. And what we need, of course, is to support clinicians with all the kinds of backing that we can possibly give them. And you can help too by not going to hospital unless it's an emergency and talking to your doctor if you have any concerns before you actually do come to the hospital. That'll make a real difference. So the beds are there for the really sick patients who get this virus. I think that's very important. And then finally, I think you need to look after yourself and your family. And to look after yourself and your family, this includes, if you get any cold or flu symptoms, to self-isolate, because you might have this COVID virus, although most won't. And if you do, you might spread it within the family. And of course, if you go outside of the family, to others. And this has to be stopped if at all possible. Doing all of this will make a difference. And I know we'll all work together to do all we can in this emergency.
Hi, I'm Andrew Miller. I'm the President of the AMA in WA, and I'm calling on the government and all the people to jump on the brakes. This virus is out of control and we really got to stop it to avoid a lot of unnecessary deaths, not only of healthcare workers, but also of people out there in the community. So we'd really want people to stay home and for the government, please, to impose lockdown till we've got this under control. We know that people will understand. Thank you so much for listening.
I'm Associate Professor David Allen, and I've been a doctor for 35 years, and I'm scared. Australia is facing a crisis with the coronavirus pandemic. Many thousands of us may die if we don't close our borders, schools, universities and public gatherings now. This action can save thousands of lives of our sick and aged, of our teachers and of my health professional colleagues. Thank you.
I'm Angelo Vigona, psychiatrist representing hundreds of psychiatrists in New South Wales. We are of the view that the nation needs to go into lockdown as soon as possible. All non-essential services should be shut down now. We ask governments of all persuasion to act now. The spread of this virus is going to lead to a catastrophe. Health workers are on the front line. We need to protect them. We need to protect the community. We need to minimise the damage.
My name is Dr. Kate Ahmed. I'm a neurologist in Sydney, and I'm calling for an immediate lockdown to try and control the coronavirus pandemic while we still have time. I'm terrified that increasing cases are going to overwhelm our hospitals and that we're going to have to make terrible triage decisions and that people will not get the care that they need. Please help us by staying at home. Even if the government has not mandated a lockdown yet, stay at home. It may save your life and it may save somebody else's.
My name is Dr. Karen Williams. I am a consultant psychiatrist. In my opinion, the current social distancing recommendations are not nearly enough. In order for Australians to make their own mind up about what needs to be done, they really need to be given all of the information, and I don't think that's what's happening. I urge all Australians to listen to the experts, listen to those doctors that are in the front line, listen to the people that are dealing with COVID-19 themselves. You need to stay at home. We don't have enough ICU beds. We don't have enough ventilators. We don't have enough doctors. If we don't drop transmission rates, people are going to die unnecessarily. So stay at home, stay safe. Try and keep your kids home as much as you can. Nothing should be more important right now.
Hi, my name is Selena Lowe, Consulting Editor at The Lancet, former doctor with MSF, also during the SARS crisis in China. What I think Australia needs to do now is test broadly in the community, isolate us with some enforcement. This is to protect the most vulnerable, including the Indigenous community, to which it must be adapted. And then accessing universally PPE, protective equipment for all healthcare workers with a good supply in the pipeline.
My name is Dr. April Armstrong. I'm a practice owner. I work in general practice, ED, obstetrics, and have done many years in ICU. I strongly encourage the Australian population to stay at home. Do not send your children to school. Do not go outside if you do not need to. Do everything that you need to prepare today to stay at home. Listen to the doctors.